Establishing emergency shelters and support services. In times of crisis, such as natural disasters or major accidents, the establishment of emergency shelters and support services is vital for ensuring the safety and well-being of those affected. This module will explore the essential steps for setting up emergency shelters and support services as part of effective evacuation planning. Before establishing emergency shelters, it is crucial to conduct a comprehensive assessment to gauge the scale of the emergency and the number of individuals affected. Collected data on the impacted area, including population density, the nature of the disaster, and any specific needs of the affected population. Once the needs have been assessed, identify potential locations for emergency shelters. Look for sites that are easily accessible, spacious, and safe from further hazards. Consider utilizing existing public facilities such as schools, community centers, or sports complexes, as well as private buildings that can temporarily serve as shelters. Once the locations have been identified, prepare the facilities to accommodate the affected individuals. This includes ensuring proper sanitation, hygiene facilities, and adequate sleeping arrangements. Coordinate with local authorities, public health departments, and relief organizations to ensure appropriate resources are available, such as bedding, cots, blankets, and personal hygiene items. Support services are crucial for providing aid during an evacuation. Key services to consider include medical services. Ensure access to healthcare professionals and necessary supplies. Set up medical stations for basic healthcare and first aid, coordinating with local hospitals and clinics for emergency support. Food and water. Develop a system to provide meals, snacks, and clean drinking water for affected individuals and volunteers. Partner with local food banks, catering services, and relief organizations to ensure a steady supply. Mental health support. Acknowledge the emotional toll of emergencies by offering counseling services to help individuals manage stress and trauma. Work with mental health professionals and organizations specializing in crisis intervention. Communication services. Create a communication system within the shelters to keep individuals informed about the situation and updates on emergency services. Provide access to landline phones, Wi-Fi, and charging stations for mobile devices. Special needs support. Identify and cater to the specific requirements of vulnerable populations, including the elderly, children, pregnant women, and individuals with disabilities. Ensure that necessary medical equipment and accessible facilities are available. Collect the necessary resources, including supplies, equipment, and personnel, to support the shelters. Collaborate with local government agencies, non-profit organizations, and community groups to recruit volunteers for shelter operations, security, and support services. Keep in mind that it is important to implement security protocols to protect individuals within the shelters. Establish measures to control access, prevent conflicts, and address potential threats. Collaborate closely with law enforcement agencies and security personnel to maintain order and ensure safety. Continuously monitor and evaluate the operations and conditions of the emergency shelters to identify issues and implement improvements. Conduct assessments to gauge the effectiveness of the shelters and support services, incorporating feedback from both affected individuals and volunteers. Establishing emergency shelters and support services is a complex undertaking that demands meticulous planning, collaboration, and resource management. By following these steps and addressing the unique needs of affected individuals, you can play a pivotal role in the successful implementation of evacuation plans, ensuring the safety and well-being of those in need during emergencies.